So my name is James Thompson, and I'm data mentor at the Australian Institute of Health and Welfare. So I'm not the actual data the sets. I don't know the data in intimate detail. I'm here representing the custodians and answering questions on their behalf. So what is the Australian Institute of Health and Welfare for people who might not be so familiar with the federal government landscape? We are about reporting information and statistics about the health and welfare of Australians. So it could be reporting on homelessness, it could be reporting on hospitals waiting times. We report on all of that information, and we produce normally fairly standard paper electronic reports. Our data that sits on the AIHW website is predominantly in Excel spreadsheets stored against the electronic publications. So the way that that's surfaced is you look at the publication, and those data sets were designed to support it. There are a number of different Excel spreadsheets that can go along with the publication. So unlike most people here who have a nice RESTful interface with which to retrieve their data, we put our data up there and hope that other people will do the rest. It's a pun. So just to back up, these are our key GovHack data sets. When I say key GovHack datasets, we've got a lot of data available that we'd love for people to use, but these are the ones that we're focused on converting to flat CSV files to surface through data.gov.au. So these are the 5 areas that we've picked mainly because they're interesting, deep datasets that we'd love to see people work with and mash up into other applications. We have our health expenditure data, which reports on how much health spending all of the individual state and territory governments invest in, what the federal government invests in, what the Australian public invests in, and so on and so forth. We have the international adoptions data set. So over time, we've got information about the adoptive families, where the children are coming from, how long it took them to get to Australia, and so on and so forth. The youth justice, at any given time, there are a number of people under the age of 18 in supervised care. And the cancer data set obviously has information about the mortality rates and incidences of cancer in Australia. Cancer, of course, is something that everybody's familiar with, and we've got quite a rich and long data set there going back a fair way. Drug survey data is something as well that is very interesting. It's a survey that we collect ourselves and has a huge range of information about not only drug use in the Australian communities, but also attitudes towards drug use. And all of that data is collected about individuals, and has some interesting comparisons to be drawn between the actual drug use and attitudes towards it. We do, of course, have a ton more information and a ton more data on our AIHW website in Excel flat files. Maybe adoptions aren't interesting to you. Maybe health expenditure isn't interesting to you, but maybe mental health is. Maybe you're interested in chronic diseases, disability. We've got all that information on the website that we'd be more than happy to make publicly available through data.gov.au so that you can use the CCAN RESTful API there. We'd really be interested in your feedback on what data sets are interesting to you, what information that you'd keen to be surfaced in that way, and what topics that you're interested in us covering with these additional data sets. So there are 2 ways, as I've just mentioned, that you can go about getting access to the data. There's aihw.gov.au/data, which will give you access to all of the categories of data that we have and the data stores there. As I said, they're generally all in Excel spreadsheets, and that's information that you can extract and keep locally and use in your application. Or you can put in a request to a data custodian or data mentor at AIHW to surface that data through data.gov.au. Currently, so I'll just give you a look at how those summary tables look, and they're largely like the summary tables that you saw in previous presentations, where it's not structured in the way that you would expect to find flat data structured. And often you've got 2 tiers of categories on the left and on the top. We also have data cubes available through the AIHW website. So those data cubes don't have an API that you can use to access that data, but you can still extract and save that data and use it in an application, or ask us to host it on data.gov.au for use in the competition. As you can see, we've got a lot of data sets on our data.gov.au site. This is something which has been a recent initiative for us in response to GovHack, and we're very keen to start promoting our data sets there. So all of the core data sets that you saw in the key GovHack data sets will start to appear there over the coming weeks. And we hope to build up that in discussions with the community about what kind of data sets that you'd all like to see available. please feel free to talk to us. I will be there on event day. You can contact us through opendata@aihw.gov.au. I'd really like it if you did that. At the moment, it's just got one email from Pierre saying thanks for the slides. And you can also go to data.gov.au, and there's ways to request information and request data sets on the site, and to vote up data sets that you would like to see available. Okay, thanks very much.